All right. Let's give everyone a few minutes. Here we go. I see some people coming in. Welcome. We're just going to get things going. We're going to share this over to our Facebook page, The Natural Pet Doctor, while we give people a minute or two to come in and join me and Dr. Betsy. Let's see. All right, welcome everyone for your lunch break or wherever you're at in the world. Okay, see if this works and get things going to help educate a bunch of people today on leaky gut, which is a term that a lot of people are throwing around out there. And I think a lot of pet parents still aren't quite sure what it exactly means. So, all right, we are up and live on Facebook. So we have a lot of information that we're going to go through today. So what I'm going to do is I'm going to do a brief introduction with my amazing guest. If you joined us, I think it was like 6 weeks ago or so. It's been a little bit of time. I've been joined by Dr. Betsy before, and we've talked all about inflammation in the gut. So definitely check that out on our YouTube channel and also on the Natural Pet Doctor page. You'll be able to find that under other videos that we've done. And so let me just introduce this amazing woman who's done a lot of really neat things, especially in the research and now switching over to the pet side. So Dr. Betsy Redmond holds a PhD in nutrition science from the University of Georgia and a master's degree in clinical nutrition from Emory University. She's worked in NIH research projects in community health, and she spent the last 15 years in integrative and functional laboratory education and research. When her own pets developed health concerns, she looked to laboratory testing that may help to better target more holistic treatments. In her research, she found that much of the laboratory testing utilized by humans had originally been tested in animals, cats, and dogs. And once she had done extensive research, she and other laboratory coworkers began to develop holistic tests in dogs to use in their own pets, and then established a business with the help of veterinarians. So this testing allows people and vets to better assess and target more holistic treatments. So we're talking about the company Innovative Pet Labs, but Dr. Betsy, thank you so much for joining me today. And I'm really excited to talk about the topic of leaky gut and our pets and what exactly it is, and kind of just dive a bit deep into some of the testing that you've been able to develop to gear people to better understand what's actually going on internally with their pets. So that way we can actually fix it rather than guess and hope that something that we're using is going to work. So thank you so much for being here.
Well, thanks for having me.
Great. And for everyone here that is on our live stream, we're going to also have a few minutes at the end for a Q&A. So you'll be able to pop those into the Q&A box. But first, what I'd love for you, Dr. Betsy, to go through is talk a little bit about like how the gut, like the anatomy of the gut, and why it might be more prone to this leaky gut condition.
So just overall, I mean, when you think gut, you think of digestion and absorption, but there's really so much more to it. The gut itself is outside the body, so it's going to be protective of what it brings in. So its goal is to do digestion and absorption, but it also is going to make sure whatever it lets in is what should be coming in. So here's like it's also interesting because it's just one cell thick. It's just that epithelial cell layer. And so all the cells, here's my epithelial cells, they're supposed to be lined up really close together. So they are, letting things go between cells and within cells. So it's a lot of processing just to make sure that the barrier is functioning. So that barrier has to function so you can do digestion and absorption. So you can absorb foods and get what you need. So I like to think about it like customs. Like you can't just come through customs and just walk through. They got to check your passport, and let it get and see if they want you to come in. Some things that come into the gut, they won't let in. Some things they'll hook to something else. Like, okay, you can go in, but you got to go in with this molecule, or we're going to alert the immune system that we let you in. So there's all sorts of things. So it's important that the immune system is happy and that the gut has all its cells lined up together, and that, so it can do all its digestion and absorption functions.
Yeah, I love that analogy to customs, because there's a lot going on in the gut, even though there's it's, one cell layer thick, we have that immune system, we have the mucus layer, we have these secretory IgAs and all these immunoglobulins that are kind of patrolling to make sure the appropriate things get through. And so I love that analogy. Now, what happens when things go wrong? Like, what is this leaky gut condition when, let's say, like, customs isn't working as well as it should, maybe, or something's
Yeah.
happening? Talk to me a little bit more about that.
Yeah, I like to think of it more like a Black Friday sale gone awry. Like people are just rushing in, like things are coming in that you wouldn't let in, and that once it's in, you have to react. And then so leaky gut is if it's just that one cell thick and they're all tight together. Is so leaky gut is when it kind of opens and things can just come in without real checks. There's still going to be some checks, but really things are going to come in, and then you're going to have an immune reaction to those things. And some of those things you have an immune reaction to are going to be at your gut, but a lot of them are going to be related to people with autoimmune conditions. So when they think of like in research with leaky gut, it's found to be associated with a lot of conditions, with autoimmune conditions like arthritis or cardiovascular disease or mood disorders. So the gut has a lot to do with all those conditions, and then having a tight, not leaky gut is going to be part of that. So if it gets leaky, there's going to be more immune reaction that's going to be associated with those things.
Yeah, and I think that's important too, because we tend to think that if you have leaky gut, you should be showing GI symptoms, and it's not always the case. And a lot of these pets who have inflammatory bowel disease or, acid reflux, or we're seeing other symptoms or, dysbiosis, yes, they will probably have some GI symptoms, but just because they don't have loose stool doesn't mean we don't have a leaky gut condition, because it's so interconnected with the rest of the body. And, just to reiterate that, I always say it's like, you should be nice and tight, and then they start leaking. We get these gaps and things, toxins, bacteria, all start, even potentially food particles that aren't broken down, start aggravating the body. And we have that gut brain axis. So that's why we see behavior issues, behavior changes, moodiness, reactivity, not being able to train them. But also too, we have the skin gut axis. And so a lot of our allergy problems, so many pets are flaring up with allergies right now, could actually be related to a leaky gut syndrome. And so in terms of like talking about what are some of the causes of leaky gut, would you say that you're seeing with when all of a sudden now we're getting that separation of those tight junctions and that one cell layer thick of the gut lining? What are some of the things that people should be aware of that may lead to that condition actually occurring?
Well, there's a lot of things. And I will say part of that, like leaky gut, also is going to impair the gut microbiome. So you spend all this time getting this great microbiome, and then if whoever's coming in is going to displace that. So it's not going to be able to, do all the functions that it's going to do. So, leaky guts, some of the causes they know, some of them they don't. They might have a little more information in human studies, but they're getting more in dogs and cats as coming along. So, I think that everybody, or a lot of the research was done looking at gluten, like is gluten's relationship to leaky gut, and that zonulin is causing, like it's identifying that there's a leaky gut, and that, these food particles, food reactions, but toxins can cause an issue. Certain bacteria can cause an issue. So, there's different kind of types. Like it can be like something, you could get food poisoning, and then, that could cause a disruption, and that could go in. So that could be a, kind of quick type of leaky gut that's more acute. So it can be associated with a lot of things, or it can be more chronic, that, there's things going on. So, any type of food allergy, and food allergies are associated with it, and it can lead to a leaky gut if you've got to deal with all these immune things your body doesn't want you to keep having and having to deal with, or dogs, anybody's body, any mammal's body. But sometimes once it happens, it's going to make you more reactive to that also. So that's going to be a problem. nutritional status. So chronic malnutrition can be an issue. Taking a lot of medications. In people, we think of like alcohol intake, smoking, excess NSAIDs, those kind of things. And you don't think of those maybe in dogs, but there are a lot of dogs who go on, NSAIDs, and there are dogs who live in houses that have secondhand smoke.
Yep. Yep.
So that's not, I mean, it's not benign for other house guests, and it's not benign for your pets. They can have an issue too.
Mm. Yeah, one of the big things too that I talk a lot about is glyphosate or Roundup and these
Right.
herbicides and pesticides. And a lot of people don't realize that that's directly impacting the microbiome. It's directly affecting that. And so that can lead to a dysbiosis or imbalance. And then that can also, we have this like circle that can occur where we end up then with like leaky gut because of that dysbiosis, but also because it's a chemical and toxin. And so there's a lot of different factors. And I always tell people too, because it can feel a bit overwhelming when there's all these things that could potentially cause, this leaky gut or the microbiome imbalances, just becoming more aware of what we're using on ourselves in our house and the food, on the garden, outside, just being aware of what other people are using and spraying on their yards too. I mean, we've got little yellow flags everywhere around here.
Yeah.
So I know I have to be super aware of like detoxing my pets, especially if I had a dog and he was walking through that. So those are just things to be aware of because this condition doesn't usually start with symptoms. And so there's a progression that occurs and then leads to symptoms being created. And then by that point, we have a lot more inflammation, a lot of more dysregulation going on in the body too. And so I love for you because you have these amazing tests that you have developed that makes it so much easier to actually identify and measure these conditions that sometimes start with no symptoms. So that way we can make sure our pets aren't on this like slippery slope of developing chronic health issues, autoimmune disease, cancer, all these allergy issues that are so frustrating to deal with down the road. So Betsy, can you talk a little bit about like what some of these tests, like especially for the leaky gut test, what they're measuring and why it's so important and helpful?
Right. So we look at zonulin, and I think that you're in, that you may not know is so true, since tend to have an analogy for everything. Like when you talk about acute reactions, like that to me is like you left your window open during a storm. You can close the window and you can probably fix it. But a more long term, maybe like a leak in your roof, and you don't realize your roof's starting to rot, and you're getting mold. So all these things are happening. And I think that's how I think of kind of like that chronic leaky gut. It just leads one thing to another. What we use and what is in the research to look at is zonulin. So zonulin is a protein. When you think of your immune cell, your intestinal lining all tight together, zonulin's a protein that's in there. There's a gluten and all different proteins, but when it becomes opened and it breaks apart, zonulin comes out. And then so it gets absorbed. So the level of zonulin is directly related to the level of leaky gut. So, and it's not, it's like a blood sugar. It's going to go up and down. So once it's up to a certain level, that's a problem. At a lower level, maybe that's a peak and you can kind of work with it. So you have to kind of do it over time and look and see where your pet is. But so zonulin is going to identify that your level of, gut permeability. And then once you know that there's a permeability in the gut, you might want to look and see what other things are going on. Like, are there food reactions? We have anti-gliadin because that's a big one. So that's been associated with leaky gut and other reactions. So it may be that it causes it, or it may be that it's just once you have a leaky gut, it's something you're more reactive to. Level of inflammation. So last time we had talked about calprotectant. So that identifies level of inflammation. So, if you have leaky gut, you can see, do I also have some inflammation? Has it been going on so long that I have this inflammation? So that's something to look at to see if there's something there. Does your dog have any autoimmune conditions? Look at those kind of things that could be related to it. So like you said, it's not just digestive issues or skin issues or chewing issues. It can be all those things. Some other things that in the research that they look at is digestive enzymes. So if there's an impairment in digestive enzymes, that's been associated with zonulin. So
Mm.
when you think of digestion, there is digestion and absorption. They're different. So food has to come in, it has to get digested, and then you can absorb it. You don't absorb it just right as it is. So if there's an impairment in the digestion, then you're going to have these big particles within the gut, and that may also exacerbate leaky gut. So those are associated with it as well. So looking at that. There's also research looking at different markers besides calprotectin. There's blood markers of inflammation that are associated with increased zonulin.
Mhm. Would that
Yeah,
be
and
more
then
like your CRP and things like that that you can look at?
exactly. Yeah.
Okay.
And there's also studies where they've actually looked at zonulin levels in serum or fecal, and then they've gone in and they've looked at, taken pieces of the gut and looked like just the snip and looked to see the level of inflammation within the intestine itself and have directly correlated that so that they know that there is a relationship there.
Yeah. And do you want me to share the leaky gut, the gliadin and the zonulin that's being produced,
Sure.
that
Yeah.
diagram, so people can kind of get an idea? So let me share my screen real quick so people can see this diagram for people who are visual like me. Can you see that okay?
I can see it.
Okay, perfect. So
So
yeah, I'll have you just explain that a little bit
yeah,
for
I'm going to
people.
move in closer to see it because I'm on my old,
Here, I can zoom
um,
in. There we go.
it's
There
like
we
an
go.
11-inch computer.
Make it bigger for everyone.
Yeah,
Oh wait,
so
that's too big.
tiny.
Okay, there we go. Perfect.
So yeah, this is specifically looking at gliadin and its reaction. So gliadin, and that so we look at zonulin and anti-gliadin. And gliadin is a protein that's within gluten. So you're going to get that from wheat. You're going to get that from rye and barley. Those can all have it. And sometimes people will mention oats, so because that can be cross-contaminated. But so when we're looking at reaction to gliadin, so the gliadin is, the little wheat gluten is, yes, the the
There's your wheat.
diamonds, so the little yellow diamonds, and those come in. And then, so this is just, they're explaining some issues. So you're going to have an immune reaction. And then zonulin can gradually get released, like reduced and released by the cells. And the zonulin is the little purple rectangles. So zonulin's going to get released, and it actually causes a little bit more of a widening of those cells. So you get this zonulin out there, and you can test it and see what's going on. So then you can see there's non-selective flow of nutrients into the blood. So just meaning that the blue things and the orange squares are things that can come into the system and get into the blood system that maybe you want in, maybe you don't. They might be too big, for one, if they're not, broken down. They might be things you don't want. They're going to imbalance the gut bacteria you already have. Your immune system under normal circumstances might do something else with it or pair it with somebody. So those things can come in. And then so it can cause an autoimmune response to things. And then that can cause more of a reaction, can exacerbate it. So immune cells, which include like cytokines and inflammation, cause the GI disease to flare up. So it can kind of get better and worse. It's not like you get it and you have it and it's at one level. It's going to come and go based on a lot of factors. So that's why we look at anti-gliadin. So this is looking at gliadin. So we look at an anti-gliadin compound to see what is your reaction to gluten, to gliadin. And then also what's your level of zonulin. So you can have one without the other. You don't have to have them both together, but they can really identify that there's a problem there with the leaky gut. And if you have a reaction to gliadin, you can go on, a gluten-free food. You can pull it out of your diet. It's not, there are a lot of, gluten-free foods that can be helpful for your dog. Also, I would look at just the overall dog food that you're currently feeding your dog.
Yeah, I'm gonna
That's
stop my share real quick.
Yeah, I mean,
Okay,
I think
perfect.
that because that's going to make a difference in your overall nutritional. So if you
Yes.
saw that, like the in the diagram, it's going to affect your ability to absorb food. I mean, to absorb nutrients from food. Like it affects your ability to break it down to be in the right format to absorb, and then it's going to impact how well you can absorb it. So inflammation, leaky gut are all known to impair um, digestion and absorption, and that can lead to nutritional status issues. So just things you want to check. A lot of people who check their dogs zonulin and anti-gluten, it's fine, and they don't have to worry about it, and they're doing good. And our recommendations just keep doing what you're doing. But
Yeah.
sometimes there is an elevation, and there can be a borderline. So we have a borderline level, so it can tell you like, hey, this is coming up and you might want to look at it and look at some of the other things. And then there's also extremely elevated, and that's kind of when there's more of an issue, and you might have to jump in a little bit more and do more to get it done. I mean, because there's a lot of things you can do if zonulin is elevated, or the anti-gliadin. Primarily, you're just going to try a gluten-free diet.
Yeah, I'm going to reshare this because I wanted people to see what they would see on this test with some of the test results that you would see, because you mentioned the normal, the borderline, and the high, and then when to be like, we need to do something. And a lot of people here are already feeding gluten-free diets where they're feeding raw diets, or they've already removed gluten and grains, but this is especially more important too if you're currently feeding like a processed food diet or kibble, and you're doing this test and you're seeing high results that are indicating that we have a leaky gut issue, and now we're going to have a digestion absorption issue too. And if we don't take care of it and we continue doing the same thing, and we expect different results, it's not going to end well for our pet usually down the road. So I don't know if you wanted to explain more with
Yeah,
like the
no, I think
results,
that
but
that's right. So you can see where they are. I mean, we have a dog that had on a gluten-free diet, but he eats a lot of things off the street. So kind of high. He walks in town. So, just paying attention to what are you eating off the street? Like we were, just a little more diligent on that. So, you
I
can
mean, here's the thing too, though, right? Life happens, and you might have parents visiting or friends visiting, or you have a barbecue and you have friends over, and all of a sudden the dog's getting like, a piece of cheeseburger buns, or like, chips and cookies. And all of a sudden it's like, why is my dog flaring up or having some issues? And it could be because of that. So things can happen. But if you know that your pet is also really sensitive to this is where you can up some of the treatments if you're not already doing, or to help protect them. So that way we are helping to reduce that inflammation and help resolve that leaky gut too.
Right. Yeah, I would certainly say life happens. We have a bakery around the corner for us, and they sell dog bones. So okay,
They know exactly where that bakery is, don't they?
they do. And then whoever visits, like, I got you coffee and your dog's a treat. So
You're like, great, thank you. We won't do a test this week. So I think, so seeing that information, so the tests are super easy to read. We've done tests with our pets, which have been really helpful too. I would, in terms of, you mentioned it's not always elevated. And so when would you look at doing one of these tests? Or is there a certain period of time you would wait? Or tell me a little bit more about how pet parents can utilize these tests to see what's going
I
on with
mean, I think that they all work for a health check. Like your
Mhm.
dog doesn't have to look like, oh, the Rovi, whatever his name is. Linda, that's my dog. Linda looks fine, but she's real old. So, I did do the test to see, like, is she okay? Could that be one of her issues?
Mhm.
Um, so just to see if that's an issue. And so if it is an issue, you can, like you said, be a little more diligent about things, like, what are they eating off the street? Get there first. If you see something, return. Um, so you can see what their health status is, and it's not, you don't want them to be elevated, but if they are, they're actionable. So there's a lot of research on what to do to help heal these things.
Yeah.
So you can take a little bit more action. We think about things like, first get rid of, if say zonulin's high, you're going to get rid of things that may be causing issues, kind of any allergens or potential toxins. Like you said, looking at, don't walk across the neighbor's yard if they're spraying it. That's can be a problem. So, look at all those things and maybe be a little more diligent. Any kind of medications that they might be on. So, see if those can be related. And certainly if you were prescribed, you're going to want to go through your vet, or talk to, a more natural vet of their natural ways to do it, to take care of any kind of issues. Look at their gut bacteria. So probiotics, prebiotics, all those kind of things can help kind of reestablish the gut as you're kind of repairing things. And checking inflammation, to see, is there inflammation? Should you use things like anti-inflammatories, those kind of support in diet? And I also think, there's a benefit in what's your pet's circadian rhythm? What's their pattern? Do they have like a pattern, like a sleep-wake pattern? Mammals do better when like, I think the biggest thing that people can relate to is if you drink coffee regularly and you miss it, you're going to get a headache because your body was like, you have coffee every morning. I'm going to make some enzymes to break down that caffeine. I'm going to dilate your blood vessels. And then when you don't drink it, you might get a headache. But because your body already knows ahead of time, it doesn't wait till it's there. It's like every morning they have coffee, so I'm going to do this. And that happens with all sorts of parts of your body, what you eat, your sleep wake cycle, all that depends on that. So looking at that, keeping a schedule, those kind of things, lowering stress.
Yeah, I was going to chime in there because that's commonly one of the areas that's overlooked is that stress and that gut brain connection, because stress can actually directly lead to leaky gut. There are tons of human studies out there that showcase this, and pets need routines. And so if we have like craziness, sometimes like being in college or whatever life stage you're in, or if you constantly have people coming and going, we need to make sure that those pets have like a safe, quiet place, that we're feeding them at the same time, they're getting their routine walks. So we're doing our best to maintain that also, because pets really do thrive off of routine and also lowering the stress environment, just like we do usually. We don't thrive off of high stress, even if we think we do. We do much better managing our stress appropriately, and that'll directly impact our pets too. And I think also I wanted to touch on, the medication piece also. There's always, even though I'm, holistic integrative veterinarian, there's always a time and a place for the quality of our pets' lives for medications. However, there's a lot of natural ways that we can support reducing inflammation naturally. Boswellia, your curcumin, there's like your deglycerinized licorice to help support and soothe. Aloe can help also with a lot of this leaky gut and repairing. Your L-glutamine is a great food source for those gut cells. And so there's a lot of natural ways that we can do to help them. And what I tend to do with my patients is when we're looking at healing leaky gut, do this test first. I'm so excited I have this test to offer now. But then what we can do is we can take it step by step to then start lowering the amount of medications that are going into our pets as we're implementing in the more like natural remedies, herbal medicine, things like that, to help them. And a lot of times these pets can actually get off of those medications because steroids, your non-steroidals, antacids, antidepressants, I mean, these have all direct links to leaky gut in humans, and they also impact our pets' health and the absorption of vitamins and minerals long-term too.
Yeah, exactly. I think that, all that kind of stuff can make a difference in supporting it. There's a human study on zonulin, and all they did was give them fruits and vegetables and increase fruits and vegetables in their diet. And some of the zonulins came down, and likely they weren't really eating any fruits and vegetables. I mean, people don't hardly eat any. And I think, if you start eating them, you're going to support your good gut bacteria.
Yep, that's that prebiotic. So for people who don't know what prebiotics mean, so our microbiome is like trillions of different bacteria, protozoa, fungi that should all be working together well in that ecosystem. They need food, and that's your fiber. This is your prebiotics. It's the food that we don't actually absorb that are specific for the microbiome as their food source. And so this is why it's really important. A lot of, especially dogs, if they're on 80-10-10 ratios of raw food diet and they're against feeding like vegetables or a little bit of fruit, we need to actually incorporate that, because that is the fiber source, the food for the good bacteria to truly optimize the microbiome. And also too, the antioxidants, the phytonutrients,
Right.
that's supporting also reducing inflammation naturally in the body too. So all that's really important and easy. Like, how easy is that? Just like, well, hopefully you're eating some yourself. If you're not, here's your wake up call. Like, you probably have some leaky gut. We need to add more natural foods in. And so put aside some for your dog and use it as a food topper. So some leafy greens, we're getting into fall here in the States or wherever you're at. It's not always fall everywhere in the States, but saving some of that pumpkin, those sweet potatoes when you're cooking them, and then adding a little bit to help support your dog's microbiome. Most dogs will eat it and they prefer it over, especially if they are on a kibble-based diet.
Yeah. Well, Linda's 17 and she loves blueberries.
She knows what's good for most of the
Yeah.
time, right?
Smart old lady.
Oh, I love that. And so when would you say, so I love the looking at these tests as like a preventative care option. So like we should be thinking of like routine wellness visits, checkups from the vet. We should be doing, especially with senior pets, at least annual blood work, looking at their CBC biochemistry. I would I would say that this would be something looking at least once a year, especially if our pets are not showing outward symptoms. So you can get an idea of where things are at internally. So, because I know for one, having gone through 3 pets with cancer, I wish I had these tests. 2 of them had aggressive GI lymphoma, and this would have helped pick up things way sooner than them showing up with aggressive GI lymphoma very acutely. And
Yeah,
so,
there's research with that too. Yeah.
yes, I love that. And so, how often would you say, like, first of all, if we have a pet that's completely healthy, normal, they're not showing symptoms, like, would you say it's once a year, or do you actually say you
Yeah,
should
I
do
mean,
it
I
more
think, yeah,
frequently?
once a year is fine, I think. And then if there's an issue, it really depends on how strong is the issue, what other things that you can, that you're going to do to change. Usually it's like 3 to 6 months that we think of,
Okay.
if you're going to make aggressive changes, you might want to go more 3 months if you're doing more slowly. And if they, also go with how they're doing. If they're getting better, you can do it, a little longer. It just is what you want to see. They're easy
Yeah.
enough tests to do.
Yeah. So it's a
And,
stool test for every, I don't know if we actually mentioned that.
oh,
So
right, yeah, you just take
it's a
the dog on
stool
a walk,
test.
and then you get your sample, and then you just put it in the stew and in the little tube. There's a spork on there you can use, or however you get it in the tube. You got a glove, and then you just put it in your mailbox, put it in a box, and mail it back to us.
Yep.
You just have
Super,
to.
super easy. And you can do this test, at home. You don't have to go to the vet and have them order it. This is what's really nice about empowering you to get the results so that you can make adjustments yourself. And I love that we can also use this to analyze how our treatment is working as we're healing leaky gut and as we're treating some of these chronic health conditions, especially because a lot of times I find people are just left like wondering, is this working? I hope it's working. Yes, we're seeing some symptom relief, but it's always nice to have a handle on how is that inflammation level dropping and being able to just do this test from home. And it's really affordable too, which is nice. So it's for people here, and anyone listening later on, innovativepetlab.com. So this is just one of the couple of tests that they offer. There's also comprehensive tests that you can do, all their tests that they offer to get a good comprehensive view of the entire gut. And you can also use the code naturalpet25. You'll get 25% off of those tests. But if you're worried, if you're seeing some vague symptoms, you're seeing behavior changes, you're seeing your pet kind of a little bit more reactive, you're noticing they're a little bit more gassy. They might have some more like displaying like acid reflux or regurg or things like that, or they're not digesting their food as well. They're getting a bit itchy. This is 100% the test. If you had to start with one, I'd be looking at this to get an idea. Of course, I love the comprehensive test because I like more information. I'm not going to lie. I love having all those
No,
puzzle pieces
it's hard to
together.
make a call. That's why I think I
I
did this
know.
lab.
I
So I
know.
want all the tests. I want it like look big picture, but all of them will help you. You know, you take it and you can try to treat it. Yeah, no, I'm getting it for Christmas presents too, because you can
Oh,
just
yeah, that's
send
great.
people the codes and it's like, you know, you can check your dog out. So it's kind of, for certain people, it's like an easy way. Some people are not going to accept that. They're going to want more. But
But
yeah.
yeah, I love that. I mean, and I love that there's more and more companies doing the at-home testing too,
Mhm.
because it's so important. And I know for myself personally, I love when I can do at-home testing to like dive deeper into my own health. So it's nice to be able to do that, for my own pets and my own clients and patients. Is there anything else that you would love to share with people today about like this test or some of the other tests, kind of like the overall view of, I know you guys have a big mission.
Yeah, we want, you know, people to be able to do, like you said, like you want to do your own at-home tests, you know, but wanting to do your dog's assessment too. I mean, it's a great way to get started if they're all really high, if there's too overwhelming. We have a lot of literature online. You can, you know, print out the results in a PDF and you can take it or send it to your vet, and then,
Yeah.
you know, so, and then there's literature on there so you can bring that too. So we didn't just, you know, make it up. It's we got it out of the literature. It's, you know, so that those are always helpful too, you know, so you can do more. But I think it's a great way to start.
Yeah. And so once again, where can they find more information about your tests, the research also? I know you have a lot of great blog posts too for people
Um,
to read through.
yeah, the innovativepetlab.com. You know, we are also on Instagram. It's a good way to, you know, look at us and see what we're doing. And you can just go online and order the test. You can order it, or you can get it for somebody else, and then they just get an email, or you get the email, you get that you're getting the test shows up. You just have to be sure to register it so we know whose dog poop that is. We get that occasionally, like, whose is this? So you got to register the kit, and then we get the results in a couple weeks.
Yep. And then once again, so easy. I've done it myself and done it with other clients too. And it's fascinating with some of my patients to see where
With
you
the
think,
box.
yep, super, super compact, easy to use. It's just like the little fecal sample tube that you get for your pets when you're checking for parasites and things like that from the vet. And you made it so easy to send back with like all you have to do is just go into the post office and here you go. Like so easy. So, if you're, like I said, if you're worried, you're concerned, what we'll do is we'll take a couple minutes for questions. If anyone has any, just drop those in the Q&A box for the people here live. But I think the biggest thing too is, looking at, this is really important. We always talk about like our 4 Rs when I'm, talking with clients and looking at their pets and making sure we're removing inflammatory things and looking at and assessing the environment, making sure that we're replacing. So as you mentioned, this test is really helpful too for looking at potentially digestive enzymes. And, for these, especially younger dogs that have loose stool malabsorption, they may have exocrine pancreatic insufficiency. And there's a lot of research articles behind this test in the human side showcasing that we can identify these pets sooner and get them treatment faster. So I love, like, there's such a great way, like there's such a broad way of being able to utilize these tests and then apply it to your pets and not have to wait for symptoms to appear, because I just find people think their pets are fine because there are no symptoms, but in reality we're on this spectrum of inflammation where we're constantly moving up and down, and we don't want to get to the point where we have symptoms, we have autoimmune disease, we have chronic illness, because it's just like falling off the cliff, and it's a lot harder to climb back up the cliff once you're off the
Right.
cliff. So this test will definitely, and the other tests that are available from Innovative Pet Lab can help people to guide them so you don't end up at the bottom of the cliff, which is so much more expensive and frustrating and scary than actually being proactive rather than reactive.
Right. And find out what you respond, what does your dog respond positively to?
Yep. Yeah. So you don't just keep like buying supplements or, the food. And if it's not working and they're staying inflamed and that leaky gut is not resolving when you retest, then you need to change something. That's really, really powerful rather than just guessing and hoping something's
Yeah,
working.
yeah. And then oh, they got better with this, so I'm going to keep on this. So then, it's more
Yes.
targeted.
Yep. Just because something worked for another pet doesn't always mean that it'll work for your individual pet. So I
Right.
love that you said that. So just more personalized care and treatment and, keeping pets happier and healthier. We're all on this mission to help pets live like their longest, best life. So, and so once again, for everyone here or listening to the replay, innovativepetlab.com, check them out. There's also the code naturalpet25 to take advantage of those. And if you've got friends that are struggling with, chronic symptoms, they're not getting anywhere, gift them some like a holiday test to test their poop. So there's nothing merrier than getting people and their pets back onto optimal health.
Right. You could go on a walk together with the dog,
Yeah.
collect the poop. We should have cats coming out in November. So
I was waiting for that because I know you've been working on that. So that'll be really exciting.
yeah, we're
So
excited.
that'll be good. So cats are coming. Don't worry. They're not leaving cats behind. They're just
No,
making
no,
sure it
cats.
works
Yeah.
so appropriately for your cat. So I'll be super excited for that. And there's lots of cat people that it'll really, really help. So that'll be great. All right. So I'm not seeing any questions today. So what we'll do is definitely watch this replay. It'll go back out. If you're not on the newsletter at thenaturalpetdoctor.com, just head there, hit subscribe, and then that way you can get any updates when we do more amazing talks like this with, Dr. Betsy and IPL and other people to help share how to optimize, improve gut health and overall health for your dogs and cats. And if you're needing guidance and help and you're not sure how to implement these different types of tools and your pets are experiencing gut health issues, make sure to check out our 6-week Better Gut Health program that we have. We have a couple more slots left for our mid-November start date. So you'll be able to see that link on the Facebook page, and we'll share that with everyone too when this replay goes out. So that way you could schedule a call to learn more and see if it's a good fit for helping to get your dogs and your cats back to optimal health. All right, Dr. Betsy.
I was going to say it'd be great to do before and after testing.
Yes, exactly. So as you go through the program, making sure that the things that you're implementing and using can help. So 100%. Yes, this is a great place for it. So,
Yeah.
all right.
All right.
Well,
Thank
Dr.
you.
Betsy, thank you so much for your time today. And we'll talk soon. And so once again, everyone, innovativepetlab.com, definitely check them out. Follow them on Instagram. They have lots of fun giveaways also. And for anyone new here, I'm Dr. Katie Woodley, the Natural Pet Doctor. We'll see you guys all next time. All right, take care.
Bye. Bye.
Okay, I think
It says recording.